real life.
Right. Good evening and welcome all of you again for a very informative and an exciting session today. We are very much pleased to have an esteemed speaker today for the day, as we are doing this event and this webinar from last few weeks, and most of the experts were from Ayurveda, predominantly from Ayurveda background. But today we have Dr. Santosh Kumar from AIIMS Rishikesh. He is an associate professor there in Department of Community and Family Medicine, and he is an allopathic doctor, MBBS, MD. He has done fellowship in diabetes and also in PG in counseling and family therapy as well. He is a wellness and lifestyle medicine expert, and we are very much happy and pleased to invite him today. And he is the Deputy Medical Superintendent as well, Nodal Officer and Sub-Dean of Social Outreach Program in AIIMS Rishikesh. He is a renowned family physician practicing in community from last 10 years, contributed his primary care services in community to more than 20,000 patients till now. He is conducting wellness programs for college students and youth, and also known as youth motivator. In fact, our predominantly audience are young practitioners and doctors and paramedical staff, and that kind of audience we have predominantly in our webinars as well. So he will definitely be connecting with all of you. He was confirmed award for excellence by National Integrated Forum, NIFA, for counseling and motivational activities for youth of nation in 2018. He is the state president of Academy of Family Physician of India, and primary looking forward for the primary care and family physician in the community. He is also the state leader of Spice Route India and a young doctor movement of WONCA South Asia region. He has published more than 18 and national and international publications, and also been awarded as a Teacher of Year award by Government of Uttarakhand, and also Best Teacher award by Director AIIMS Rishikesh. He has honored with HIM Ratna by Honorable Governor of Uttarakhand as well, and Seva Ratna by Government of Uttarakhand. He has also been awarded by University Human Rights and Social Development Associations for outstanding services in community and society, and awarded by Garhwal University and SSB Government of India as well for outstanding contribution in remote and rural medical services in hilly area, because that is one of the toughest area to practice and to propagate the healthcare, which Dr. Santosh is doing with excellence. So hats off to you, Dr. Santosh. And award of excellence by Amar Ujala Foundation, Shashwat Ratna Award, Ambedkar Ratna, and many other awards he is having in his kitty. So we are very much happy and pleased to have you, because I personally also belong to Uttarakhand. I have born and brought up in Roorkee, and I did my college from Haridwar, and I pretty well I'm aware about the geographical locations of Uttarakhand and the challenges and the extreme conditions sometimes we need to face as a practitioner. So we are doing with an excellence there. So again, a very much motivated profile, which I can personally see. And we are all looking forward to have your guidance and today your talk on how we all can propagate predominantly. We all are connected to the society in terms of providing healthcare and in terms of the primary healthcare. But yes, we will be looking forward from your experience how we can optimize and take it forward to the next level. And without wasting much time, I know all the audience are eagerly waiting to understand you about your experience, about your learnings. So over to you, Dr. Santosh. Again, thank you so much for joining, and we are looking forward to have a very informative and exhaustive discussion from your end. And I request all the audience, you can post your queries and questions. Let Dr. Santosh complete his talk, and after that, we will discuss your queries and questions with him as well. Meanwhile, wherever you are seeing us live on YouTube, Facebook, you can post in your questions in the comment section. And I request our digital team to share with us so that we can take the questions after Dr. Santosh will conclude his talk. Thank you. Dr. Santosh, over to you. Thanks.
Thank you very much, Dr. Piyush, for this kind introductions. Ladies and gentlemen, good evening. Myself, Dr. Santosh from AIIMS Rishikesh. And first of all, I welcome you in health and wellness session organized by Namo Ganga Trust Yogshala. I know very well that all ladies and gentlemen, you must have gone lots of hectic schedule. Probably you must have contributed lots thing for the mankind on day. So I would like to take you all with me through the wonderful journey of our exclusive, which is going to be exclusive for you. You know that in this the hectic schedules or ups and downs, lots of emotions, we need a static life, peace. How to do it? Focus, concentrations. Ladies and gentlemen, stay tuned with me. Definitely you are going to get something, how to be healthy and how to be well. If we have to see our image in the water, it should be very clean, isn't it? In a similar way, if you want to listen, if you want to focus, if you want a peace, then we have to be very clear, first of all. So I'm giving you some instruction, please be with me and follow it. First, I would like to draw your attentions and request you to please close your eyes and inhale. After inhalation, you are supposed to hold your breath for 5 seconds. After holding your breath for 5 seconds, again you will exhale and stop your breath during exhalation for 4 seconds. And accordingly, you will follow my instructions. Please close your eyes and inhale. Hold your breath. 1, 2, 3, 4, 5. And exhale. Hold your breath. 1, 2, 3, 4. Inhale. Inhale. Deep and shallow breath. Hold for 1, 2, 3, 4, 5. Exhale. Please be with me, calm and cool. Inhale, deep and shallow breath. Concentrate. Hold. 2, 3, 5. Exhale. Continue your normal breath. Now, focus on the biggest source of energy ever we have in entire universe. What is that? Our brain. Each and everything starts from here and ends here. I request you, please focus. Close your eyes and please focus. Please focus your brain, the most powerful weapon, powerful source of energy. Now, focusing on your eyes, your nose, your lips, your chin, your chest, left hand, right hand, stomach, right thigh, left thigh. Now concentrate on left leg, right leg. Well, now start looking at you. You always look yourself in mirror. I request you, at yourself with your internal eyes. Feel yourself, because we are the important creations of the God. We are important. Accept yourself and closely and gradually open your eyes and look at the screen. What I was sharing with you, that power source of energy. When you started thinking, the action start when we start thinking, ladies and gentlemen. We have undergone through the enormous stress crisis during this COVID-19 pandemic. Thus, I thanks once again the Namo Ganga Trust who have given me this opportunity to organize, to conduct this session in the wellness, where we are trying to understand what is health and wellness. It has been described, it has been said, and it has been explained thousands of times. Still, we are ill. Still, we are not able to overcome with our day-to-day issues. I would again try to draw your attention towards the most powerful, most dynamic, most important organ of the human brain, where still we have not reached completely, ladies and gentlemen. Believe me, look at this. What we are going to address, what we are going to discuss today. Health. What do you understand by health? Each and everyone, please stay tuned and tell me what is the health. It is not a new. I'm not going to tell you something new. I'm just here to sensitize you what is existing. What I'm going to discuss, the physical health. If we're talking about the wellness, wellness is nothing but it is the offshoot of the health. Offshoot of the health. If you are healthy, that's no matter of wellness. The physical health, mental health, social and spiritual health. The 3 and 4 dimension makes our life. It makes our life. Either it is Ayurveda, Unani, Allopathy, Homeopathy, everywhere we're talking about this 3 and 4 dimension of the health. And believe me, we are not able to overcome. I'm going to take you through this journey, wonderful journey. Please be with me. What I'm going to discuss, that disease. We know each and everything. If you ask some rickshawala that I'm having a headache, then he will give you the 100 reasons, hundreds type of therapeutic and therapy for the headache. We know each and everything now. This is the time, ladies and gentlemen, when we have to understand what we don't know. We need to understand what is the knowledge transformation. We have to understand what is the practice. Something we'll be discussing about the relationship, achievement, and emotions. And what is the social and spiritual health? Do you know? There is hundreds of books have been published over the social and spiritual thing. But what I say, the overall impression of the positive psychology. If you are physically well, mentally well, that's the impression what you are going to have. That is the social health and spiritual health. Well, you know that we have more than 72% of the diseases, non-communicable diseases, hypertension, stroke, diabetes. We are suffering, and every 5%, one is having either he's a morbid, either he's a diabetic or hypertensive, having a stroke, cancer. What do you think? Do we have a scarcity of doctors? No. Do you think this is a deficit of health science, medical science? No. What is the potential cost, ladies and gentlemen? This is the time to understand. I'm going to address the youth, and I'm requesting to the youth, try to understand. There is nothing like the deficit of medical science, nothing like a deficit of doctors. Nowhere I'm going to take you the role of doctors over here. What is necessary, what is mandatory, that is to create the awareness, to realize the people where we are. What is the potential cause? Do you know what is the heading? Ignorance. Ignorance, pain, illness and disease, you know what? You know what? That we ignore. We are very expert in the ignorance. You know, tell me one thing, who doesn't know that obesity is the curse? Who doesn't know that the diabetes, potential cause of diabetes is obesity? Who doesn't know that the alcohol is injurious to health? Who doesn't know that the smoking kills? It is mentioned in the wrapper also. But we continuously ignore. We ignore. We don't give importance. And because of this ignorance, we have a pain. Ladies and gentlemen, I would like to draw your attention. Whenever there is a pathology inside our body gives a signal, but we ignore that. Right? We are taking pizza, burger, junk food. We are ignoring that. And it ultimately causing a pain. Again, in a little pain, we are ignoring it. The pain is a manifestations of the inside pathogenesis. It is the pre-pathogenesis, and ultimately it's transformed. It comes into the illness. So when we wake up, when the illness get devastating, when it's transformed into the disease, then we go to the hospital. Then we go to the hospital. When the patient comes to us at the disease end, we are failure completely. What we do, we don't cure, we treat the disease at the disease state. And where we can cure, when the patient can come to us at the initial stage, when it's having a pain, but usually we have a fever, we ignore it. If we have a little pain, okay, we ignore it until we get the severe stage. Well, we ignore the warning sign, warning signal. Well, you can understand, you can feel. When you take the heavy food, your stomach gives you a signal, okay, this is heavy. You are having a belching, you are having acidity, but you don't stop there. Second thing is the poor acceptance, ladies and gentlemen. We are very poor acceptance, but we are not ready to accept that I'm obese. We are not ready to accept that we have a diabetes. We are not ready to accept I'm fit. We are not ready to accept that I'm not fit. The moment when you don't accept, you don't start your exercise. Am I with you or not? The moment when you do not accept yourself, it means you are wasting, not wasting. In fact, you are spoiling yourself. If you have a bike, you have to accept, now I'm having a bike. Why are you unnecessarily showing that you are having a four-wheeler? If you are pretending that you are having a four-wheeler, that you are implicating yourself, you are creating yourself, you are creating problem for yourself, and you definitely are going to challenge that, face that challenges. If you have obesity, until you accept it that I'm an obesity, you are not going to take the actions how to reduce the obesity. But problem is that you are not ready to get the, okay, I'm not obese. That's the problem. When you have a COVID-19 positive, despite having a positive result, people are not ready to accept that I'm having a COVID. What can the poor acceptance? You are intelligent, accept it, I'm intelligent. You are energetic, accept it, I'm energetic. Because at the moment when you think, your action starts similarly. But if you don't think, if you think that you are obese, then you will start taking a step how to get rid of the obesity. But we don't know. Anyway, where is the gap? We have a knowledge, but we don't practice it. We do understand that alcohol is injurious to health. We do understand the obesity causes diabetes. And tell me, ladies and gentlemen, who doesn't know that the junk food causes the obesity, the lack of exercise pull us and push us in a category of obesity? Who doesn't? Each and everything we know, and today at the era of overburdened information, we have access of information through the internet. We are full of knowledge, but do we practice it? The point when we are not practicing, there is no knowledge transformations. There is no use of that knowledge if it is not transformed into the action. I know very well that smoking is injurious to health. Smoking causes cancer, alcohol causes cancer, alcohol causes hepatitis, fatty liver. But I'm taking alcohol daily. I know very much that the exercise is very important for health, for mental health, to make myself fit, but I'm not doing exercise. It means I have only knowledge. I'm not practicing it. It means there is no use at all. Ladies and gentlemen, what is required? The knowledge has to be transformed. You know what? Why the knowledge is not converted into the practice? That's a very beautiful thing comes in existence. That is our attitude and belief. Or it doesn't make any sense. The people keep saying, "Do take the sweets. Today is the life." If you are not taking rasgulla, sweets, and a lot of things, nothing going to be happens. But the pizza is the one of the very interesting things. Yeah, we have to take it. We have a knowledge. We ignore it. Our attitude, our belief is interrupting us to convert the knowledge to practice. At the moment we think, okay, we should get up at morning and go for the exercise. Some of the beliefs say, nothing happens. It's like that. Remember, ultimately we come to the Bhagavad Gita, Yuktahar Viharasya. Yuktahar Viharasya. Yukta Chestasya Karmasu. Yukta Sapna Bodhasya Yogo Bhavati Dukha. Ahar, Vihar, Vyohar, Vichar, and Bhavana. These all things are required to live a good life. Today it is required. Where it is required, anything in excess is poison, ladies and gentlemen. That's become, the people started becoming the dependence and addiction. You know, nutrition. What do you understand by nutrition? You know, I do understand many of the people are from Ayurvedic and wellness, who are working in the wellness are listening to me at this time. There is no need what to eat, what not to eat. But what we are practicing, come on, the nutrition. When you attend a marriage ceremony, what you do, there are also 30 types of food varieties are there. Do you taste each and every one? Or what do? You select by your own choice. Why do you taste each and every one? That nutrition, what you have to take, what you won't take, what should not be taken. Anything, I'm not talking about good and bad, even in the milk. Even you are taking, just consume 2 dozen banana in one time. Just tell me then what will going to be happen. If you have a good digestion, please consume 2 liters of milk at one point of time. Just tell me what is going to be happen. It means anything in excess is going to be dangerous and going to be poison. But somehow, if you are making excess, if you are addicting towards that, every time you are liking pizza, every time you are liking like some exclusive things, which is giving you pleasure, which is giving you satisfaction. Some people say that I'm having a good type of satisfaction with that food. I'm not. If that food is not going to be prepared, either it may be non-veg, it may be vegetarian, it may be anything, it may be cheese. So they are so particular for that. It means it is you are being particular and you are gradually becoming dependent over that. And that particular substance is going to harm you if you are taking it in excess. In a similar way, the mental tonic, what is that? In a tonic, the doses you are taking, the nutrition, if you are taking an excess dose, it is going to harm you. If you are taking in a very balanced diet, the concept of balanced diet, you must be understanding. If you are taking in a balanced way, it's good. If you are not becoming not craving, you are not craving for particular. If that particular substance will not serve, its party is useless for me. At that stage, you are having a craving for that substance. And ladies and gentlemen, I would like to inform you that now you are going to be poisonous for the nutritive values. What is mental tonic? What you have to take and what you have you are not supposed to take. That is the mental tonic, because hundreds of thoughts that comes and giving an impression in your cerebral cortex, impression in your mind, right? Lots of emotions, lots of perceptions. And that's when you started giving the shelter of thoughts in your mind, your emotions starting building that. So now it's up to you. What is you are allowing, what you are not allowing. If you are allowing all the thoughts which is disturbing, which is making you turmoil, which is making you disturb, which are putting you in stress, then definitely this is not a good mental tonic for you. And please, I'm assuring you, environment influence. If a normal IQ person is growing in a beautiful environment where there is always a good discussion, a community of intelligence, where you are there talking something different, innovations, intelligence, that's a normal IQ person can transform into the high IQ. And ladies and gentlemen, the environment is right now having a right hand over the genetics. If you have a good company, good environment, then you have definitely going to have a very productive result and very productive and positive effect. Be careful with what you are taking mentally, what you are taking nutritively, and in which type of environment and which type of people you are living. If you are having a company with the depressed people, certainly you are going to be depressed. You have to, whatever potential and whatever power you'll put. So please create a positive environment and be in touch with the positive people. Environment affects what you are supposed to do. Assess. If you are going somewhere, then please assess that food is how the food is good for your body, what nutrients you are getting, how this food is going to act in your body, how it is going to act in the stomach, how it is going to influence your mindset. Because now we are talking in the allopathy, even the brain gut axis, whatever you are eating, it is indirectly or directly affecting the central nervous system. Assess it. Is it fruitful for you or not? Either it is a thoughts being unnecessary inserted in your mind, or it is a food that is being served to you deliberately or not deliberately. As a youth, you have to assess it, ladies and gentlemen. If you could understand this line, my success, I'll understand the success of this webinar. First, assess, feel it when this pizza will go inside your stomach, when this junk food will go, what is the role of this junk food in the body, how the nutrition you are taking and how it is affect your body system. Then analyze. Okay, in 1 and 2 time you can take it. I'm not criticizing any of the things. 1 and 2 time you can take it, but you have to analyze. Is it 1 and 2 time, or are you not going to be repeated? You have to analyze, then go for the access. What is required for life? No, what is required at the end? The emotions. The emotions that comes from our childhood. When a neonate, in fact a child, 1 year old, you will get an opportunity to interact. You find he or she is also emotional. And the thoughts, whatever that influence your mind, your behavior started, your behavior become like that. And from where the emotions comes which have been in your mind, that has been deep rooted in you since your childhood, but it has been given the different type of flavors with the different type of thoughts. This is bad, this is good, this is not very good, this is very, very good. This thoughts has been given to you by the community, by the society, by the environment. That's why I'm saying that's very important. The emotions you have, how you are nicely influenced. Okay, to whom you are influenced, how do you react when you are reacting, and what type of thoughts what type of thoughts are creating, and what reactions you are giving. Your reaction is the offshoot and the consequences of the emotions and thoughts. And your behavior is like that. So it means if somebody is angry, it means that he is in not good mood. You say, okay, his mood is offset. He's emotionally disturbed. So don't blame his behavior. Talk to him when he's cool, when he's silent. Ask him, okay, gentlemen, tell me, what is your problem? Do you have some problem? Definitely will come out, yes, I'm having some problem. My behavior is by this way because of my emotions. I have been influenced by some tragic news, and I have been badly traumatized by somebody, like that. Okay, anyway, what is mental health? That not seeking the positive emotion, because I have told you, if you have negative emotions, ladies and gentlemen, you have been anger, frustration, burnout, distress. Where it is coming? Emotions. Somebody, if you're in a classroom and somebody came to you with your girlfriend and insulted you in front of your girlfriend. You are in your family and you are with your teachers, with your colleagues, somebody came and insulted you. When somebody insults you, what is that thing which affect first? Can you answer me? Yes, that is the emotions. I am badly affected. I was, how dare you to talk me like this? I have never done this thing in my life. So the first stage, when you influence, when you affect, that you are emotionally damaged. If my professor is scolding me in the classroom, I have been emotionally turmoil because my image is gone. That these all stresses, these all emotional disturbance that filled in our mind, brain, we get frustrated. Now our condition is like this. Our condition is like this. That is called the bloated balloon. Okay, initially, suppose I have been scolded by my professor in the classroom. I was silent because I could have not, I cannot retaliate, I cannot answer on that. And problem is that we do not share our problem anywhere. We do not share. The problem comes to whom I should share. In my daily routine practice, my patient comes to me, my youth comes to me, sir, tell me whom I have to share. If I share something, sir, I'm feeling very stressed and I'm feeling, the people started making my mockery. The people started giving comments, oh, this is, so that this is a balloon. When you think that it is a completely bloated one, or this bloated balloon, you can understand that if you are having the condition like that, if you're having a condition like that, you can say that what is going to be happen. Now, these are completely filled of the anger, frustrations. And as soon if you are not able to ventilate your feelings, suppose this one is the stressor anywhere. This is the stressor. So what will happen when you suppress your feeling? If you are suppressing your feeling, it is coming again. So better if you are suppressing your feeling by this way, it is rebound. So there is no benefit of suppressing your feeling whenever you are in the frustration, whenever you are in anger, because as soon you will suppress it, it will again escalate your feeling. It will again increase your emotional turmoil. And if this type of situation, suppose any stress situation comes in contact, so there is a big ground, there is a big sounds. I means this type of bloated balloon, if you are filled with emotions, negative emotions, and continuously you are not ventilating it, your friends, it means anytime you can burst, and this sound may be dangerous at any point in time. So what the positive emotions? You have to be positive. If sometime you become negative, then you have to be cope it. You have to talk to the people. You have to share your emotions with other. Now, what is engagement? That is true. it is required for the good health, right? Please believe in your passion, create your passions having some meanings. Okay, I mean, you should be engaged with the activity so that you feel you are lost completely. And where you can lost when you are having a good passion. I think the hobby word should be eradicated from the dictionary. There is no type of things are hobby. Hobby means just a time pass. Be passionate, but remember your passion should be having some meaning. It means then you are having a good passion of, you are passionate of having a reading book. Some of the people have been died in front of you, but you are not reacting because you are good passionate with that. No, this meaningless passion is addiction, ladies and gentlemen. You have to have a meaning. Meaning means you have to have a conscious mind. If you are having a good, if you are if you are having a good music, or if you are having a good way of passion with anything, then be with your conscious mind. Well, now just we will come to having a relationship, that is most important part that has to be balanced, because the relationship we cannot ignore. We have to take it, how to balance it, because there is no end and corner of emotions. It's a practical. And second thing is that what is usually listen, accept me as I am, it is not acceptable at all, because things cannot be accepted as you are, because the people are the different people. We need to be flexible at every point of time, because we cannot relationship. Why? Because if we have a poor social relationship, then it's the biggest cause of coronary heart disease. I mean, poor social, it is the research, poor social relationship lead to increase heart diseases. That's, we need to have a good relationship. But right now, whatever problem we are coming up because of the relationship, then you have to balance, nor you are supposed to be good or not bad. But what I have discussed, and whatever passion you have a happiness. Okay, please be happy, please accept the things, but you need to have meaning. It should be having some meanings. Was that's I'm coming over the accomplishment. We have two things: the pleasurable activities and happiness. What is the pleasure? The pleasure release the dopamine. I mean, it's the momentary things. And happiness, we are talking, the happiness is for the long lasting. Whenever you want to achieve in your life, somebody wants the momentary education, momentary motivation. Momentary motivation means, suppose I'll get the 1 lakh rupees, then I'll do this. But it is momentary. Maybe sometime your work is not praised, appreciated, your salary may be deducted. But second thing is the internal motivation. Whatever you get from internally, I want to serve the community, I want to be a good yoga teacher, I want to reform the yoga. That is something you are thinking about the external, and if you complete it, if you achieve it, that will provide you the happiness. Pleasure can be attained by taking alcohol, but happiness cannot be attained by taking alcohol. Happiness is the long goal, while the pleasure is the very short goal. Pleasures always, it follow the sorrow and frustration. Happiness will always give you satisfaction. Well, ultimate things is, I'm going to cover my presentation within 5 minutes. That's the brain reward system, where everything, whatever you think, whatever you prefer, whatever you feel, it is registered in your brain reward system. If you are getting frustrated and you are taking alcohol for the pleasure, that is registering in your brain reward system, and this reward system is asking you to follow the same in the coming time also. Like in second time, whenever you will be getting frustrated, then again your brain will hint you, send you a signal, gentlemen, you just go for the alcohol, because next time when you got frustrated, you have taken the alcohol. That's why I'm just saying you and emphasizing you, whenever you are taking either your nutrition, either any emotions, analyze it. Otherwise, it is going to register in your brain system, and that will allow you to follow the same repeatedly, and it will become addiction. Sometime it become habitual. So last 4 minutes only, that we have the thoughts what we have discussed, and this is the last slide I have. And whenever you have any problems in the life, So please increase the circle of your thoughts, because when the problem started bigger, so you please magnify your thoughts. Maybe you will started taking that problem very short. So ladies and gentlemen, this is health management is free and enjoyable. Disease management is very costly and painful. Thank you very much for your patient listening. Thank you.
Thank you, Dr. Santosh. It was really a very nice and informative talk and an eye opener in many aspects which you have discussed and touched upon on various aspects of. It's a kind of a enlightenment for all of us in terms of your. I think the real combination of the scientific as well as our ancient knowledge and ancient textbook knowledge. There are very few doctors like you who have been trained on the allopathic system of medicine. Still, I have seen in your presentation you were quoting a shloka from Gita and many more aspects you have quoted. And I think we all are basically Indians and we need to proud of our old ancient textbooks and the ancient knowledge. And without maybe seeing it in a negative way, let's like take it forward. And people like you who have been trained and been achieved so many degrees and qualifications on allopathic system, on scientific parameters. Internationally, also you have been trained and being exposed, and you are right now at one of the premium institute of our country, that is AIMS Rishikesh. Still, you are referring to this ancient textbook knowledge and information, and you are correlating in a very scientific and logic is there. It's not hypothetically you are just quoting anything. You are correlating everything, and there is a science behind everything. In fact, every sutra and every shloka, there is a science which you have beautifully correlated and infused. I think that is the requirement, and as our government also, and like everybody is looking forward to promote. It's a kind of a soft power for us in terms of the knowledge which we are having. So thank you so much again for this mindset, and beautifully you have mentioned all these aspects which will definitely help all of us to uh, elevate our mental health, physical health, and many aspects are there. There are a couple of queries I have received in my messenger as well, and I request the team you can quickly share any queries are there on YouTube channel and Facebook, and I request all the audience also who are listening to us, you can post your queries right now, and we can discuss with Dr. Santosh. First question is, Dr. Santosh, that see, we as a healthcare professional know, and whatever you have explained right now, but sometimes there is a challenge in the community or in the society to disseminate or sometimes to propagate this kind of knowledge. So, kaise, like some tips or maybe some your real time experience, because you have exhaustively worked at the ground level with the communities and you are a specialist in community medicine as well. So I request you to share some tips to all the fellow. Like we have a very major ratio of audience who are healthcare professionals or paramedical staff. So some tips which you can share on your basis of experience, that how we can disseminate or propagate this kind of knowledge to the masses, to the society, to the community. वहां पर क्या bottlenecks या क्या challenges आएंगे और उसको हम कैसे face करें और कैसे उसको हम, क्योंकि कई बार sometimes it's a bit technical for them to us to explain, and sometimes they are not able to connect. So wahan par your experience will definitely help us. Please guide sir on this.
Well, of course, this is very good questions. And if we talk about the community, the first, what I would like to tell you that the primary care is the backbone of the health system. Whatever advanced system you are generating, ultimately the primary care. And if you primary care will work, if you really want to strengthen the primary care, we have to make our approach to the community. So what was mentioned, what I have mentioned in my slide, I have started, that is the ignorance. Until we fade away, until we eliminate this ignorance, pain, and illness, we cannot overcome from the diseases. But how we can go? But the question is how we can go. If you go to the community, just as visiting the community will not fulfill our aim. Or by just sitting in an air-conditioned chamber, we cannot imagine what is really happening. With the community, we should understand first what are their own problem. Because you know that suppose somebody is coming to me and asking the question which is completely not related. What I would like to listen. Suppose some of the student is there who has to pass his final year examinations and he is pursuing his career in Ayurveda. If somebody is talking in the similar context, okay, what you are supposed to do after passing your BAMS or BHMS, whatever, then he will be most interested rather than if somebody is coming to him and talking unnecessary about the cricket and football and these all things. So when we go to the community, first we have to ask, that is called the need assessment. What is their need? Do you have a need of food? Do they have a need of sanitations? What is their need? Until we address the need of the community, we cannot make a rapport building with them. We have to make a hand holding with them. If they are facing some problem, so we have to be at there. We have to put our leg in their shoes. We have to put our foot in their shoes. Then we have to think. Directly, if we are going and we are asking, we are giving, because I have a lots of session in the information, education, and communications, and I see. So I encourage people, don't go and give the lecturing. No, no one is ready to listen the lecture right now. So just hand holding. First, assess their need. Then, if you assess their need, if you put your foot in their shoes, then they will try to ask you. They will try to what are the barriers, why they are not, what are the barrier that is interrupting them to get this knowledge. You are ready to give them knowledge, but they are not ready to take it. So what you have to assess that gap. What is that gap that is interrupting the knowledge which is being given by you and which is not reaching there? And that gap is called knowledge to do gap. Knowledge to do gap. Maybe they are having a knowledge also, but they are not coming in a practice level. For that, we have to first go need assessment. Second one, that we have to have a rapport building with them. Third one, mobilizations. We have to mobilize them. We have to have a continuous and sustainable activities and sustainable effort with them. And last one, if we have to show live example, if we have to give some results, though public health activity is the gradual one, but after need assessment, after making them a rapport building, good rapport building, and continuous interaction with them, we have to come in a point so that we could make them benefited. Benefited means in the terms of their well-being, in terms of their healthcare, in terms of their government facilities, in terms of anyone. Anyhow, we have to make them benefited. We have to make them a relation just like a family. Then probably after a certain time, they will definitely listen. I have a good experience. People are listening. Yes, sir.
Right, sir. Thank you so much for this clarification. I think definitely if we follow this particular protocol, we will be able to have more successful footprints and better connection. Now, there is one more question which we have received. As far as we know that there are so many lifestyle disorders which are prevalent in our society, in our country, like diabetes, cardiac, hypertension, many issues are there. As you have guided us through your knowledge and the presentation which you have discussed with us, and so what do you think, what kind of specific diseases, like for example, one which we have understood in terms of the psychological issues, anxiety, stress, insomnia, definitely some kind of hypertensions are there, which can be very well managed if we follow some balance and we follow the practices which you have discussed with us today. Apart from that, any other disease or any other specific health conditions which you have felt? Yes, we know that somehow the system is also related to our mental condition, but many other diseases are there. So, as per your experience and as per your journey till now, what kind of specific, because again, the society or the people will connect to their diseases. If we tell them that, okay, this particular disease in which it will help, so they will definitely practice or they will definitely take it forward. And for the clinicians also, sometimes it is also helpful to correlate certain techniques or certain tools with a particular disease. So in that scenario, maybe you can share some of your learnings or experiences so that we can connect and correlate, and accordingly we can propagate to the society as well.
Well, of course, it's a very nice question, or it should be discussed. If I frankly say that usually that is ignored, that problem is ignored. That's why I'm continuously saying we are not ready to accept. If you say somebody who is depressed, you are making a diagnosis of depression, and the patient himself feel also depressed. If you ask him, gentlemen, you are depressed, he will not accept that I'm a depressed. Any patient who is in stress, if you ask it, you seem to be in stress, no, he will not accept that he is in stress. If you ask them, any person who is in the severe depression, no, he will be in the low mood, he will be in front of people, he will never accept that he's a depression. If you ask him to go, I'm referring you to the psychiatrist. In fact, he'll abuse you sometime because of the stigma, but he won't accept it. So the burning problem right now is psychosocial stress, and the psychosocial stress itself contributing majority of the diseases. Tell me a single disease where this factor is not associated, and it is contributing a very significant way, very significant. If any person is having a diabetes and he's having a severe stress, sometime immediately, sometimes clinician is not able to understand up to what extent the insulin dose has to be increased. The stress is having a very drastic influence on the diseases. All the non-communicable diseases, the diabetes, hypertension, and this psychosocial stress, depression, anxiety is having maximum control. Right now, what WHO says, WHO endorsing this, each and every physician should be skilled in the biopsychosocial model. So whenever a patient is coming, I would like to tell you, in each OPD, in every OPD, if some practitioner are listening me, you just feel in every OPD, if you ask one question, how they are feeling. You screen each and every patient for the anxiety, for the stress and depression. I assure you, more than 40 to 50% of the patient are having this either depression, either mild depression, either stress or anxiety. Stress is good. I'm not asking you. Stress is good. If stress becomes distress, he's not able to sleep, he's not able to attain his normal routine, then it is a problem. Everyone, we have a stress, you have a stress, no problem. But everyone, that now the later stage of stress is the depression. So first disease, definitely it is going. And during this COVID-19 pandemic, due to the economic stress, economic crisis, due to somebody might have lost someone, or the youth, they are having their blurred career because competitive exam have been postponed and their teaching is going online, so that every third person is having a depression. But we are not ready to accept it. We are not ready to accept it. It's a challenge. It's a challenge. And second disease, if you ask me, if you want to practice, then the gastrointestinal problem is drastically increasing. That's why I've taken the example of nutrition, because this is the time when we have to follow, of course, like what the slogans are, Yukta Ahar Viharasya Karma Chestu, just what I have mentioned. We have to follow the concept of nutrition, what to take, how much it should be taken, what should be your exercise. Because if you are saying the gastrointestinal OPD, we have a majority of patients in the gastrointestinal, in the gast having the gastric problems, indigestions, peptic ulcer disease, acidity. These are the IBS. And ultimately, these all diseases get complicated into the more severe diseases. So gastrointestinal and psychosocial. And I have already mentioned that brain-gut axis is mixed up. Whenever you are having a gastrointestinal problem, definitely you will not be happy. Automatically, you will come down and land up into the depression.
Right. Agreed on this point, Dr. Santosh. Again, you have crafted your answer very well and beautifully you have mentioned, and with all the scientific parameters, you have really very well quoted the WHO reference as well in this regard. So thank you so much again, and I can see like from last an hour, we have been uh, having a nice presence today of our audience, and it was a really informative session. In fact, we will create the entire video. It will be there on our YouTube channel, and we will share with all the people who are on our network. We have like thousands of doctors, paramedical staff, and in fact lakhs of people in the community as well. So what we'll be doing is we'll be sharing this video to all, and I will request the digital team to share the link with Dr. Santosh as well, so that he can share in his own network as well, because this was a really very nice and informative session, and I think very unique and innovative way to correlate certain scientific parameters and fundamentals to the ancient knowledge, and to provide a holistic approach, I think, which is the need of our right now. And all of us at some extent are facing some kind of stress due to the pandemic, two lockdowns. Many things are being affected, and each of us is having issues in our personal as well as professional life. But yes, the solutions which Dr. Santosh have discussed today are really very much helpful, and definitely we all need to adopt that in our life, as well as we need to communicate and propagate to the society as well. So thank you so much again, Dr. Santosh, for sparing time. We know that you are a very busy professional, but you spared an hour for us today in this session. And we are looking forward to have many more informative sessions with you as well. Thank you so much again for joining today, and have a great week ahead. Thank you. And I
Thank you,
thank,
sir. Thank you very much.
right, thank you. And I all thank all the audience for joining us today again. Keep supporting us for all the events and webinars. Thank you so much, and have a great week ahead. Thanks.
Thank you, sir. Thank you.